Okay. Let's see. Okay. Um, Today we're going to hear a very moving and heartwarming medical success story. Carllie, thank you so much for being here with us today. Carllie is Sam's grandmother. She adopted both Sam and his sister Zaya. She's been caring for Sam since he was 5 months old and caring for his sister since she was 6 weeks old. And both children have very severe neurological disorders. Um, Sam's included autism, seizures, eczema, banging his head on the wall, dreadful food allergies, and being severely constipated. When we first started, when he was 2 years old, he could make sounds, but not words. Zaya presented a whole other set of concerns for Carllie. So today we'll be hearing about Sam. So it's really a pleasure to introduce you, Carllie, and really a person that I consider one of our local unsung heroes. So yeah. Um, so let me see. And then I guess if we could just start out kind of talking a little bit about what moved you to adopt both Sam and his sister, because you really took on an enormous challenge and responsibility. So
Can you hear me okay?
yeah. Hmm.
Biologically, they were my grandchildren, and every family member, I think grandparents, close aunts and uncles, you really have a feeling for a child and seeing what position it's in and feeling like you can contribute and make it better. So for me, it was a bit of a custody thing, waiting for the foster system to go through and the adoption process to happen. But I never wavered from thinking that not that I'm better, but that I could give them something that they neither could get at the time they were born and at the time that they were going through the things that presented.
Yeah, and I know there was both exposure to alcohol and then to drugs in utero for both of the kids. So,
Yeah. Um, both kids were diagnosed with fetal alcohol syndrome. And Zai was born a drug baby.
yeah, yeah. But really their story is so inspiring. Sam's story is so inspiring. So we started treatment when he was just 2 years old with me, and now he's 15. So I'd like to go back to the early days. Can you tell us a little bit about how he was doing before he started treatment with our office?
Um, he he cried all the time. Um, for him, everything was extremely loud. The sensory processing and hearing the sounds contributed to his epilepsy because he would get startled and it would lead into a seizure. And that was happening anywhere from 12 to 35 times a day at that point. We went through multiple medications. We went through several doctors. Ultimately, I was told, you need to go to the mainland. We can't treat him. He has two types of epilepsy. So it was one of those things where you just make the best decisions for your family and never give up hope. Hope is everything.
Yeah, yeah.
If you if you look at someone and say, "Oh, there's no hope. I'm just going through the motions," is not the same as looking at them and saying, "You can't do it yet, but you're going to do it."
Yeah. Hmm.
Because your emotions and the energy that you present to a child, it has an effect on them, whether or not they completely understand your emotions. It's like when you're happy, they're happy. When you're mad, kids often get that mad tone too and not know why they're mad. So our energy and what we give them is extremely important.
Yeah, yeah. And I know there was a neurologist who told you when Sam was young that do you want to share what he told you?
Yeah. I retired from my job there. I was police department, and we moved to California because we were outsourced from Hawaii medically to Chalk Hospital. And the first time the doctor saw Sam, I sat him down with a brand new puzzle. I took all the paper off of it and handed it to him, and I brought several just to keep him occupied. And this doctor told me just by looking at him, not reviewing anything else, just by looking at him once or twice in 45 minutes, that he was never going to be anything. He would never talk. His IQ would never be above 45. That he was, and I don't like this word, but he said he's mentally retarded, and you need to accept that. You need to get a grasp on reality. There is nothing that you can do that will ever change it. It just happens to some kids, and you, like other parents, just need to get a grip on the reality that therapies are just not worth the money. It's not. You're wasting your time and your efforts. And that inflamed me, and I fired him,
Mm.
which was kind of a shock because you don't generally fire doctors, but I didn't like the way he was talking. And in that 45-minute conversation, Samson put together two brand new puzzles that he had never seen. And each time he put a puzzle piece in, he would and I would look and say, "Yeah, good job." And I'd grab another piece and I'd hand it to him. And none of that mattered to that doctor. So I can tell you there are great doctors out there, and then there are doctors that um, have preconceived notions about fetal alcohol syndrome, about autism, about epilepsy. Um, Having Dr. Taketa, even when we moved to the mainland, being able to have televisits with her and keeping my kids on track with the medications and the supplements, which are a blessing. Because when conventional medicine does not work, treating the whole patient and the whole body and trying to take care of it like that is a completely different thing that's really not accepted even to modern doctors today in some fields.
Yeah, and I remember like the you told me that that doctor had told you just save up your money for to put him in an institution when
And put
he
him in an institution. He said,
right.
"Well, if you have him on Social Security, you could." He's just you need to accept. And I was like, as he was talking, I was just kind of staring at the top of his head, and I was listening, but I did not want to say bad things back to him because I was angry. But he said to you, it's the best thing. And that was the part that made me feel like you've just give up on my kid. You don't know him.
Mm. Yeah, and I remember that that first visit that we had. I remember the whole time. I remember
Yeah.
Sam was just he was screaming literally the whole time. It was like a 2 hour visit, and he was screaming so loud. I remember we couldn't even hear each other to talking, so we'd have to like wait until he stopped to take a breath, and then we would talk really quickly, and then he would start screaming again, and then we just have to wait until he stopped to take a breath and and then he would start screaming again. And the whole time he was trying to bang his head on the wall, on the floor. We're just trying to keep him from injuring himself.
Yeah.
Um, and I remember that first visit. Um, so, can you tell us a little bit more about like what he was like in those early days?
Yes, thank you for taking on the challenge.
Yeah.
um, Different medications made him extremely docile, where he would just lay there and drool for
Mhm.
hours. And then some medications did not have that effect on him. So everything with sensory processing, uh, the brain is very young. So what a normal path looks like and what um, a spectrum child looks like is a bit different. So how they process sound, how painful it is, um, light, things moving, creates a lot of fear. Samson had a lot of fear of things. He would lot, even when it wasn't, you know, where it was something really scary. He would just, if you put your hand in front of his face, he would react, and then the screaming would not stop. There was a lot of screaming. We started sign language, even the very simple, basic sign language. I stuck Cheerios on my head so that he would pay attention to me with eating. And then during the eating process, every time we would eat, we would have to sign. We couldn't get it. I didn't care how loud he screamed. I didn't care what the neighbors thought.
Mm.
If he didn't say want or more, he didn't get it.
Mm.
So food is a driving factor for children. I
Yeah.
just say that. But it
Yeah.
was it was a rough couple of years. But learning different things, um, like the Qigong massage,
Mm-hmm.
that was one of the hugest things in his life that helped to get a few hours of sleep at
Mm.
night. He would get like an hour and a half of sleep and then we'd be up. But that was like the most docile, relaxed, calm. Even if he didn't go to sleep after the massage, he was receptive, you
Mhm.
know.
Yeah. And I remember, medically we did a lot of blood tests, different kinds of, stool, urine tests, and found that there were a lot of imbalances in his body, that there were a lot of issues with his gut, with the brain. There was brain inflammation, methylation issues, mitochondria issues, a lot of different things. And so, we used a lot of different vitamins and nutrients and, things to help. And I remember when we first started, he didn't have any words, he didn't have any language. Um, but then I remember, and he had a lot of sleep difficulties. I think when we first started, he was only pooping, I think like once a week or so. And then a lot of food allergies. And so it was a process also of you trying to figure out the foods that he could eat, that he could tolerate, that wouldn't give him a rash and things like that. Um, and so can you tell us a little bit once he got to be about 5 or 6, what were some of the ways that he changed?
Several things changed, and it wasn't all at one time, it was gradual, but I kind of kept a notebook. When I noticed something new, I wrote it down. When something was big and I felt like this thing connects to all these other things, I really paid attention to that. Starting supplements, that was humongous. Um, Bigger than I can ever say, because getting the B12 in him, getting GABA in him, um, they actually took him off of GABA, and the seizures came back in bigger fold. And I was like, no, 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 I don't care what you do. We're continuing with this GABA. Um, we went through different things, and as we went through different things and we found out different things about his health, like his mitochondrial issues, that is so big with spectrum kids. And I do not use the word autistic because I feel like that word is a stigma. I can
Mm-hmm.
say my child has autism, but we just don't use the ick word. Um, so learning the different things and starting different supplements and going through um, how these things work and how things started to get better. I never forced him to speak verbally. I forced the school, every school that he went to, in his IEP, it said that they would speak sign language. So that was a big advocate thing for him. But really, it was so that he had a voice, because he didn't have a voice. He could not. And he had a physical injury along with his epilepsy running through his brain. right in the speech center. And so trying to form words, once he could throw out a word or two, it would not necessarily be the word that you would want. Like, do you want to eat? And he would say, horse, horse. Um, so getting this, it's not fast, it's not quick. If it is, then that's magic, and that's a great thing. It was not fast for neither of my kids. Um, Samson did not stop having incontinence issues until he was about 8. And he didn't actually start talking in school, not one word, until he was in the 2nd grade. No teacher had heard him talk. They just heard him, and signing. But he actually started to talk. Um, I could just say it takes patience,
Yeah.
and it takes trying to put yourself in that set of shoes and problem solving. What is the problem? What
Mm.
is the problem? And just constantly trying to put yourself there to make it better. Because what's better for them is better for you.
Mm.
I get
Mhm.
to sleep all night long now, and that's a godsend.
Yeah. Yeah. Uh, and so for our viewers, we'll talk with Carllie next about how things are going now for Sam. But first, I just want to underscore that the other doctors and I are naturopathic medicine physicians. So it's a medical specialty that combines cutting edge science to diagnose and traditional remedies to heal. And we're also trained in acupuncture and Chinese medicine, which gives us two additional and powerful medical tools. So for anyone who's watching, if you would like to talk with me about any health concerns, we do a free of charge phone consultation. So you can just call our text office to schedule that. We just want to make sure that what we do is going to be a good fit for your needs. So you'll find all the contact information on our Facebook page. And then I also just encourage you to support our work by visiting our online supplement store, which is on our website at Dr. Taketa-Wong. That's drtaketa-wong.com. And we have a 20% across the board discount. Our prices are very competitive, but the main thing is that the proceeds go to helping children with special needs with their medical treatment. So a link is in the post with this video. Um, so again, we're talking with Carllie, a grandmother who adopted two children with severe neurological conditions. Um, and his treatment has really changed a lot over the years. And I mentioned a lot of the supplements and things that we did, nutrients to help to address mitochondrial issues. There's a lot of nutrients that help. But I know you had kind of compiled the list of the things that you found the most helpful for him over the years. Yeah.
Yeah,
Could you share with us some of those things that you found the most helpful for Sam?
sure. Um, Baby First TV. Baby First TV is when I absolutely knew that the doctor at Chalk was not putting any effort, because when they, and if you don't know what Baby First TV is, please look it up. Um, but when they would start talking about colors, he would sign the colors. So when Color Crew came on, he would be going, "Yay, colors, yay!" And then he would do like red and blue. And I was like, that doctor's out of his mind. It's a good thing I fired him, because he didn't know what he was talking about. That was amazing. Sign language in itself gave him a voice, because I needed to know when he was hot, when he was cold, and I would intentionally make him hot, make him cold to get responses. But he would talk about the horses, and he would talk about cows. I cannot say enough about supplements. I cannot. We did hyperbaric chamber with you, and that really sparked verbal sounds that were more um, intelligible, because he would say no, but it didn't come out no. It would be like yo, but he would sign, but he was actually trying to communicate verbally. That hyperbaric chamber was amazing. We did a ketogenic diet. And for autism, I cannot say enough about eliminating sugar, dyes, milk, and adding coconut oil. Coconut oil is your best friend. Drink it, wear it, drink it some more, cook with it. The Qigong massage for your child with autism by Luisa Silva. That was the thing that helped calm him down enough that even if he didn't go to sleep, I could actually do something without having my hand on him. Um, we did sprouts therapy there in Hawaii. They have moved to Kailua now, but Miss Crystal is fabulous. Samson was one of her first kids when she opened. He had She gave him the ability to feel good about himself and accomplishments. Zip line, ball pit, walking on the rails, and they used sign with him because he wasn't going to talk or whatever came out didn't sound like words. They were amazing. Later, we tried amino acids, and the amino acids in the form of pills and in the form of shots has been extremely helpful. Nicotine gum has been helpful in his later years, where when he's faced with being in 10th grade, he has all A's. His lowest grade is a 95. He has been honor roll since the second grade. They did not give grades, and that was in Hawaii where we started. Here, um, his physical grades are, I have always been 91 or above. And that's through all of his challenges of leaving school early, not being able to be in the room with all these people. That was a big thing. But the growth and the change is important to understand that there's this big stigma that, well, a kid's a sponge till they're 10. And they've learned most 60% of the things that they're going to learn in their life, but you if you go past that age, you may not get any results. And I find that absolutely to be false.
Mm.
Every day, um, I'm never shocked by being surprised at something different with Samson. I broke my arm. He learned to cook.
Mm.
He cooked all the meals. I told him what to do, and he cooked all the meals for 6 months. It was a
Yeah.
severe break. And I could just tell you from my own experience and all the parents that I talked to, and I talked to a lot because I was a school parent advocate there in Hawaii, in Las Vegas, and here in South Carolina, where we are now. I've been a parent advocate for, he's 15, but I've been a parent advocate for 19 years. And all the parents that I talk to tell me pretty much the same thing. Oh, yeah, my kid, you know, somebody told me my kid didn't start talking till he was 11, and now he won't shut up. And I didn't know he was that smart. He's smarter than me.
Mhm. Yeah.
So just have faith, have patience, forgive yourself, forgive your kids.
Yeah. Yeah. And so and now Sam is I mean, so now he is able to talk, he's conversational and um yeah, and no more seizures. He's been off of seizure medications, I know for a number of years now. Yeah. Um so, yeah, and that he doesn't have any more constipation. He's not trying to bang his head on the wall or
No,
anything anymore. And I think that's really the power of, when we're working on these things and really addressing the underlying cause, that's the power of what can happen. Because, and I agree with you. I've worked with teenagers, with young adults, and I've still seen improvement, even with them, so I tell parents don't, think that it's too late because there's always things that we can do. But I think that's the power of that persistence and the commitment and keep going, because that's something where is we call it like a slow motion miracle, right? I mean, if that were to happen over
Yeah.
like a month or a year, it'd be called a miracle. But I mean, it still is a miracle, even the fact that he's improved so much over all of these years. Um, he's a totally different young man now than when he was two.
He's looking
So,
at his graduation plan. He knows what he wants to do after school. He wants to work HVAC. He knows he has to go to school for anywhere from 15 months to 2 years. Make no mistake when I say the miracles are real. You also have to understand that a lot of times our kids are gentle souls.
mm,
So Samson can still get overwhelmed by people yelling. Um,
mm,
he has learned to do his hands a certain way to help him calm himself, maybe go to the bathroom and wash his hands, remove himself from whatever the action is that's upsetting him. But now he can advocate for himself and say,
mhm.
I got to step out. I need a break.
Right. Yeah. Yeah. So,
I can say one last thing if it's okay.
yeah. Uh-huh.
If you want to know how your child is doing, get you a 12-month calendar or print the 12 months. Every day that something good happens, just pencil a little star. Go back and look at that 6 months, a year, and look at that. And there's your physical proof that you saw. It doesn't matter if you don't remember what that thing was. It matters that you knew that day that we're moving forward, we're making progress, something good happened today. And just by doing that, you're going to see where the stars are far apart and the stars over the years get really close.
Mm,
But it helps you to see that what you're doing and what you're giving and what you're contributing. It's like, I'm not a grandparent. These are my children. And it's like the day they moved in, they became my children. They don't call me grandma, they call me mom. You will see in this calendar their growth by your little stars.
mm.
Take that as a win. And on a
Yeah.
bad day, go back and look at the stars and go, okay, I got hope it's going to happen. Something good. We've had 5 days of, oh my gosh, I can't stand it. But
Yeah.
we're going to have a star tomorrow.
Yeah. Yeah. And that persistence, I mean, it's just amazing. And just it's just amazing. So thank you so much for sharing your inspiring story.
Sure.
And thank you, to Sam for being willing to share that. And yeah, so thank you.
Absolutely.
Yeah. And for our viewers, I trust that today's event has been useful for you. I'd certainly welcome the opportunity to discuss any specific health concerns that you have so that you too can be empowered with your health. So, to do so, just call or text our office to schedule a free of charge phone consultation with me, so that we can make sure that we talk with you about your needs and that we're individualizing it for what your needs are. And you'll find all the contact information on our Facebook page. So I want to say thank you, mahalo, and look forward to seeing our viewers in a couple weeks. Aloha.
Aloha.